is. Whoa, whoa.
Hello, welcome to our Friday webinar. That's the way to start it. Dr. Tully, thank you for the
Yeah, that's it.
all
Ready to
right.
go.
Woo, let's do this. We are doing another great episode of Ask the Vet, and I mean, how great is this? We get to figure out. I mean, I get to come along for the ride to see what great advice you give our participants today. So,
And
especially
the
at the height of the
great
holidays.
questions. Yeah,
That's
and
right.
the great questions that we always get. Yeah.
So just a reminder, if you have a question for Dr. Tully, to use the Q&A button, not the chat feature. But just real quick, if you do use the chat feature, tell us where you're logging in from, because I love seeing where everyone's joining us from. So please do that. And yeah, let's see here. Well, as we wait for the first questions to pop in, because they're going to start flying in here any second. Thanksgiving is next week, so any advice heading into the holidays for chicken or turkeys? Okay, yes, for birds.
Well, the only advice that I have regarding Thanksgiving is down my favorite holiday, U.S. holiday. And the reason is there's no expectations. It's just that people can get together and and be thankful and have a chance to get together. And so that's why, there's just no expectations on this, and we get some time off and just to reflect a little bit on what we can be thankful for, because a lot of times we just think about what we and sometimes it's good just to think about the things that are are nice in life. So anyway, that's my advice
Well
on
said. Well said. I'm going to be thankful for my bird and my family, but
that.
yeah, absolutely. This is
Yes.
okay, you hit it now. That was spot on. Thank you. Okay, now I'm going for we got our first question is oh, it's more of a comment. Where's your silly turkey hat? Don't you have a turkey hat?
Oh,
Didn't you have a turkey hat last
oh,
time?
speaking of turkeys, like I got off the phone with a referring veterinarian that is sending in a full-grown turkey today. And we have seen turkeys over the over the number of years in practice, but today it's kind of seasonal, and well, hopefully we can find out what's going on and get him back up to speed so he could giving also.
Wow, is it a tom turkey, like a big turkey thing?
I haven't seen it. I just got finished talking with her on
How
that, so
exciting.
I think it is a tom turkey. Mm-hmm.
Nice, nice. Okay, all right. Okay, got a question about a budgie for you. 6.5-year-old male budgie has recurrent crop infections, and this has happened since June. The cultures and gram stains have been done every time, and he is put on a 10-day course of Clavamox, which is one of the drugs that the culture recommends is effective. The infection clears within 2 to 3 weeks after, but then it reoccurs. The environment is clean. They disinfected everything. They have other birds and they are not sick. So he just came home from a 7-day hospitalization in which he's getting injectable piperacillin, I hope I said that right, and is now on Clavamox again. So what course of action for something like this and that keeps reoccurring? So what's your take on that?
And the reoccurrence is stated as a crop infection, correct?
Um, I believe so.
Yeah.
Yep, crop infections.
Okay. Okay. And then what we have to look at is that if we're looking at a crop infection on this budgie, in fact, what are the problems? When did she notice, like, well, hey, my budgie has a problem. I'm going to take it to the veterinarian and see what's wrong with this crop. Okay, why is it not? Is it regurgitating? Is it not moving the food through there? Is it not eating? usually with inflammation of the crop, called ingluvitis, that the birds usually regurgitate on a somewhat routine basis, which of course is not normal. You can argue that they can do it under amorous circumstances, but if that's not the case, then this would be something that would be problematic, and that's what we normally see with regurgitation is crop infection. Now, this is where it gets interesting. It's like it appears that your veterinarian is doing a fantastic job and trying to get to the bottom of it. I think that there was culture and sensitivity was mentioned on this, and the bird is on Clavamox. It gets better, and then it doesn't, and then it kind of regresses, and so you have this problem that it's like, gosh, I just went through all this treatment, the bird got better, now it's the same, and then do it again. It's just like Groundhog Day. And so it's for a veterinarian, for a doctor, we don't want to keep seeing the patient for the same thing, and so usually you treat and you look and you try to identify what is the most likely problem with this. And so this is a budgie, and it has this, and so one of the most likely case with this regurgitation is an ingluvitis, if it isn't crop infection, is bacterial infection, and you treat it and it gets better. And that's what, and if it doesn't get better initially on treatment, if you don't do a culture and sensitivity, then you do a culture and sensitivity and you make sure that that medication is correct. Now, one thing is that the bacteria could get resistant. There could be resistance if it's been on Clavamox, and it may need another culture with that. One thing that we do have it currently is what is called My Dog, and so on cases where, and that is MIDOG, and that is like a kind of a genetic or a DNA screening. I'm sorry, DNA screening of a sample to identify bacteria that you may not identify on routine cultures on auger plates. And so this is a more sensitive test to pick up bacteria, that certain bacteria need specific environments to grow. And that would be culture media. That means the environment in which they're in. And so this test has really elevated our ability to detect bacteria that on routine culture you wouldn't be able to do, or wouldn't be able to grow. And so this is something that's an alternative for routine culture if the initial culture doesn't seem to be being treated. So that's something that can be done. Also, you have a budgie that is one of the primary problems with the GI is the Macrorhabdis ornithogaster, avian gastric yeast. And so this avian gastric yeast, called megabacteriosis, early, before it was kind of identified as a yeast or a fungal organism, but that's something that is you're not going to pick up, and this may be an underlying cause of the recurrent bacterial infections. It's not to say that this little bird has recurrent bacterial infections, but after 2 or 3 times, you have to think, of treatment and not working, what's causing these bacterial infections? And often what we'll see in birds is that you can culture that bird initially and then treat it, it gets better, then it has a relapse, and then you culture it again, it's a different bacteria. And you treat it, it gets better, and then you culture it again because it's relapsed again for the third time, and it's a different bacteria or multiple bacteria. What is causing this bird to be susceptible to these organisms, this infection? So you have to get down to the bottom of it, and which is why your question is so great. So there's something underlying that the treatment just isn't working. One, again, you identify it, but it seems like the bird recovers and then doesn't. So that's why there may be something within the GI tract, such as this avian gastric yeast may be in there, and it's hard to identify. But you can do a crop swab and then a cloacal swab in that order. You can look at it under the microscope. You could do a fecal sample. The shedding is not consistent, so it just because it has it, it doesn't mean it's going to shed. But you may be able to pick it up, meaning that it is very specific, but it's just not sensitive. It's not a very sensitive test, but that's something that you can do. Unfortunately, the treatment is at this point, I would say, not very effective. But that's one area that the bird, one disease condition the bird could have that would cause these secondary bacterial infections that don't seem to resolve with treatment. Another thing, and then we see this, and I've seen this in birds, and we have a manuscript we're trying to get out there, and it's just like it's really, I guess, underreported. Okay, and I think that there's more of this out there than this condition than not, and that is stomach tumors. And the stomach tumor can cause of course, you can imagine having a GI issues. Well, one of the things with cancer, of course, you can have a breakdown in the immune system that really kind of promotes these secondary bacterial infections. And of course, you can treat the secondary bacterial infection, but that's why you have the relapse, right? Reoccurrence of the problem, because you treat it, but the cancer doesn't go away. And that just gives another opportunity for another bacteria to get in there. So with your little budgie, I'm not saying that it is stomach cancer, but to me, it's more likely that it would be something like avian gastric yeast. That's kind of a secondary issue, causing these secondary bacterial infections. And then if again, on some of these cases where the original culture and sensitivity and treated it with the that's beautiful, treated it with the bacteria, the antibiotic that the bacteria is sensitive to, it responds but doesn't go away, then that would be a reason to possibly do this my dog culture, and then try to see if you're missing, may have missed something, or if that bacteria is still there, but it's resistant to the clavamox. So that was a great question right off the bat, because it hit so many different points with a common problem. And then most times you have a crop inflammation or associated with an infection, you give it the antibiotic, clears up. But the frustrating part here is that you treat, and then you've been in there 7 days, and then, you know, the bird is doing well, and then 1 week later it's back to normal. You go like, what am I, you know? And I can tell you that your doctor is thinking the same thing. Like it's a frustrating. We have to go into these a specific process, a specific protocol, one step at a time to try to identify what it is. Avian gastric yeast, you may not be able to identify, or nor a tumor, but that may be a couple of reasons why you have these relapses. There you go.
All right. All right. Next question is best way to trim a 28-year-old cockatiel's nails. 28-year-old cockatiel. Yeah.
The best way to trim a 28-year-old cockatiel nail, claws, if you will. Again, when you are looking at grooming, there's many different thoughts. You could have 50 veterinarians up here who treat birds and have 50 different ways to trim the feathers. Some say, you know, the flight feathers. Some would say, oh, we'll never do it. And then, you know, and then there's others that, you know, as myself, you know, there's certain ways to do it to try to protect the bird. But nonetheless, it's the same way with claw trimming or nail trimming. One thing that you're looking at, that's we've had advancements over the years. That thank God we've had advancements. We know that when you trim the claws of a bird, that it's painful. You know, there's no way around it. It's painful unless you just use an emery board, just scratch the surface of that point. Then that wouldn't be painful, but stressful because the bird's being held and getting, you know, its claw scratched on an emery board. But if you're going to trim it, and when you trim the bird claw, what I'm looking at is when you trim the claws, like, well, what's the landmarks on the claw that you use? And so my general landmarks for trimming a claw is that I use the plantar surface of the foot here. Okay. Now the blood, you know, so it's painful because if you're going to trim it, you trim where there's tissue that's alive, the quick. So if you're going to trim it to be effective, you know, that you're going to quick the bird. So it's painful. Like if you clip a puppy's, you know, claws or a rabbit's or what have you, and you quick it. Most of the time you can't see that. You can't see that, but it is there. And then also it bleeds. Okay. So you have a 28-year-old cockatiel, and I routinely trim a 28-year-old cockatiel going on 29. And like I said, the advancements is that because this is painful, we do have pain medication. We can give an NSAID to try to reduce the pain, like that would be similar to Tylenol or Advil, Onsior or Robenacoxib or Meloxicam are a couple of that we use. And then also, depending on the bird and its condition, we can sedate the bird. We sedate most all of our cockatoos and large macaws. And sedation is not full anesthesia, but it just really takes the edge off, and it is a wonderful, and it's one of the and I would say one of the biggest advancements that we've had, especially as it relates to grooming, is sedation, is sedating the birds. Now, if and depending on the cockatiel and its general, how it responds and general attitude may be sedated. We don't sedate all of the birds that we see. However, so what's the best way to trim that? Well, what we normally do is try to reduce the bleeding. We don't want bleeding. Um, uh, and if there is bleeding on the claws, I like silver nitrate sticks. I don't, there's powder that you can use. You can shove powder up against it and stuff like that. But silver nitrate sticks I like because it is on the end of it's like a cotton tip applicator. It's a long wooden dowel, and then the silver nitrate's on the end, and it's dry. And then when it touches that blood, it activates and becomes a liquid, and it's a liquid hemostatic agent. Okay, and so we can pinpoint where exactly we touch that, and then we put pressure on it after we touch it with the silver nitrate stick with say a 2x2 or 4x4 gauze sponge, and then that, and it's not every time we just touch it, it'll stop bleeding, but sometimes we have to keep reapplying. But it is a quick way, to target where that bleeding is occurring, and we don't have powder all over the place. The one thing about silver nitrate is that when it activates and becomes kind of a liquefied, it becomes kind of a liquefied part on that tip of that cotton tipped applicator. If you get it on your skin, it's like henna. I mean, you'll tattoo yourself for a little while. It's so that's the silver nitrate. So we try to reduce the bleeding, but we do have that hemostatic agent if we do have bleeding, and usually younger birds, and we don't have to really worry about that in a 28-year-old cockatiel, but younger parrots have softer claws. You may be aware of that if you've raised younger birds, but they have a tendency to bleed more than older birds, just birds that are older in age. But we use electric cautery for birds under 150 grams. So that would include a cockatiel and then your small conures. But over 150 grams, we use the Dremel tool with the sandstone burr. But the electric cautery, of course, it just it cuts right through the nail quickly, and then it also provides hemostasis as it makes the cut. So that's how we do that. And like I said, some of the birds we sedate, some of them we don't, but we do provide that pain management for the bird, and that is, I think, important in an advancement over the last 10, 15 years that we've had with claw or nail trims on that. Yeah.
Okay.
All right.
You nailed that. Nailed it. You're drawing. You're always good at the drawing. Love it. Question about what is your preference for avian recumbency position while sedated for a physical exam, a general physical exam?
Well, usually my preference is to have the assistant hold it while I do the physical exam. So the bird would be the bird would be in a kind of a prone position, okay, with somebody holding it while I examine the bird, because I'm going to need to have the bird to look at everything from the tip of the head to the the tail. And so go through and normally, teaching, it's not every case, and it's dependent on the patient and what we're doing, but in general attitude and ability, but looking, at everything, and I'm going to need to manipulate to feel, palpate, and to see and extend. We have at least to kind of make sure that we do not miss anything. We have a kind of a form, eyes, what's the hydration status, what's the body condition, what's the joints, movement, and that's an external exam. And so I can only, and that's when we go through and if we're going to do a true examination of what's going on inside the bird, as I say, and outside, which is a total physical exam, just looking at the bird is only half the story on a physical exam. Then we'll collect the blood first for the diagnostic testing, so we don't miss it, so that the exam and doesn't affect anything. The one thing about the physical exam is that you want to do it. You want to assess the patient. Can the patient go through a full physical exam, or is it only partial physical exam? And we have to do what we have to do to assess whatever is the problem. And then once we determine that, the bird is here for an annual physical exam, it's doing well, there's no other problems, then the one thing about it is that you do it expeditiously. You don't waste any time. You don't delay. You take care of business, but you do everything you can to examine that patient on the outside, and then you, of course, you'll sculpt the heart, with the stethoscope and breathing. But that's all, what you can do, but you do it in an expeditious manner and very thoroughly, so you don't miss anything. And listen to the owner, and make sure that you address what their concerns or issues are, and then again get that inside exam with the blood work.
Okay. So the next questions is actually so a round of questions that have a common theme of toxicity. So I'll go through one at a time. It's on a list, so it's a combination of questions. So first one is, are gooseberries and goldenberries okay for parrots? Are they toxic? Are they okay?
Are gooseberries and goldenberries?
Yeah.
Well, gooseberries, are they edible?
I'm gonna Google. I'm not sure.
And what I would say is that that's a good question, and you stumped the vet. Okay. And I do not know. But if they are edible for humans, kind of a fruit for the most part, I have not ever heard that they were toxic. But again, I think that the first criteria would be, are they edible for humans? Now, that there are things that we can eat that other animals can't, and vice versa. And we talk about avocado. We've talked about avocado in the past, but I'm just not aware that that they are. I've heard that they were toxic, but the first criteria, I would have to look at that, look for that. Yeah.
Okay.
Good. Yeah, that's what this is. Ask the vet.
Right. Stump the
Vet
vet.
doesn't know everything. That's for
Looks
sure.
like, just to my general Googling, it looked like they're both edible. I don't know if they
Yeah.
have to be prepared in a certain
Yeah,
way. But
that's the first step. That's the first step. Now one thing about berries and fruit and the fruit itself may be edible, but the seeds may be toxic. But that's the other thing to look at. But not aware of that. But that's something always to just because the fruit's edible doesn't mean that the seed is uh, edible.
okay. This is just in time heading into next week. A question about, are bags to cook turkeys toxic to parrots if in the same room where the cooking is done? So, I guess they have the bags that yeah.
Well, what I would say is that the one thing, I mean, the birds could be in the room where the cooking's done, but I think it's a bigger. That's a great question because I think it's a bigger um, issue than just the bags. Um, the what it does is it makes the bird susceptible to a cooking mistake. And we have all been part of a cooking mistake at one time or another. The problem is that if we do have one and that it's hard to bring a bird back from a respiratory um, compromise or trauma if it's an inhalation issue from a cooking mistake. So the bags themselves, I haven't heard that there was toxicity associated with fumes associated with cooking. But however, it's just not the bag itself. It's just having the bird in that close to that environment where there's potential, a good potential for eventually having a mistake that can't recover from. And so I would just in general recommend not having the bird there, and, as it would be just to reduce the chance of exposure to anything that would be problematic. I mean, like, you know, I, you know, I just remember my wife steaming vegetables
Mm.
and she was steaming vegetables, but she put everything in the pot and the strainer and the vegetables and the lid, but just forgot the water, and so um, the bottom of the pot melted, on the alloy on the bottom, and so there was of course fumes with that. So I mean, I'm
Yeah.
calling her out today.
Yeah.
But I'm just saying we've all been there, and so that was a great question because it's just part of a bigger picture, and I
Yeah.
think that's the picture that we've all heard about, and just as so everybody's aware, you have your birds where they are, but you just need to be aware of you know the advantages and disadvantages of things like that. So that was an excellent question.
Okay. Yeah, I think remind us that some of these bags, they might have Teflon or chemicals. So I imagine just cooking in general, like any kind of Teflon coated pots and pans or nonstick and all that stuff. The ventilation can probably go a long way too, keeping the kitchen properly ventilated and your bird kind of away from it. But
Yeah. Oh, yeah. I mean, it's kind of like the Grim Reaper, or the Angel of Death. I mean, if because of fumes that have been associated and people who've been, know about cases where Teflon has gone through a room after it's been aerosolized, and multiple birds have been affected. Some birds are dead, other birds are doing fine, but it's just the airflow within the room and where it's concentrated and where it goes. It's like, it's kind of like that. What was it? Uh, the Moses movie, where the angel of death came through and came
Yeah.
through. It's a fog, but that's the way it is, the Ten Commandments. But it's when they go through and but that's so you don't know. I mean, you could get away with it if it happens, but it's not just Teflon. I don't think Teflon was involved in the pot. It was a stainless steel pot, but I don't think that the vapors from that alloy that were liquefied and burned were Teflon. But I don't think that they were. Uh, uh, I don't think it would have been good if a bird breathed those in. You see, well, and so that's what we're looking at. Just like the air fresheners, the air. I don't believe it's Teflon that we're looking at. Is some of those plug-in air fresheners that are problematic. But it's just like, be aware and and do what you can to try to reduce that from happening.
There we go. All right, another question for you about a toxic thing is what type of cleaners are safe or what are not safe to use around birds? So if you have to clean your bird's area or the area around, your bird's cage, the area around the bird cage, the room your bird's in, what do you recommend for cleaning? What should you avoid?
Well, the one thing that uh, recommend is if you're cleaning, I always like to bring, you can't disinfect dirt. If you ever see anybody ever spraying, or on TV you see people spraying dirt with disinfectant, that doesn't work. Um, and so it's organic material. So if you really want to do the best you can and you're going to spend time uh, disinfecting, you have to remove all of the fecal material, all of the sea or pellet, whatever, all of the organic material, because disinfecting is only effective surface to surface. Okay. So if you have little dirt particles on there, whatever's under those dirt particles isn't getting disinfected, you see. So, or if you have you have a fecal, where the birds pooped and it's cemented itself to the bottom, spraying it isn't going to disinfect it. So I always like to just kind of put it in perspective. You cannot disinfect dirt, okay? And that's organic material. Now, what's safe? What I use, there's products out there, and but anytime you use a product, you want to, and you're trying to clean, and we're talking about disinfecting, Laura, is that what we're talking about? Kind of cleaning,
Yep.
you know,
Disinfect. Yeah.
you could use, again, vinegar, and kind of a dilute vinegar solution, it works. Just kind of as a natural product. I know that like a Windex, if you have a Windex, that is fine. And dilute bleach, dilute, very dilute, and the one thing is when you say, well, how much? I don't have I'm sure you can find that out there, but it's not. I don't have a specific dilution. to use, but if you have that it is very dilute, where you just have just a kind of just a slight smell of a bleach smell, not something that's overpowering, that is an effective form of cleaner disinfectant. Now, the one thing that I want to remind everybody is that when you do this, you want to make sure that the birds are not in the cage or the enclosure while you're doing this, okay? And let it air out. You can put a fan on it to increase, the turnover and make sure. But by using any of those products I mentioned, once you have that, there's the fumes, an hour or two with out, that you'll be fine. You'll be fine. Yeah.
Okay. Okay. And then a question, can I apply aloe or any type of cream to unbroken skin on a bird who's a feather plucker?
Uh,
Can you, do you recommend it?
can you? Yes, you can, but should you? There's the other question. And the if you have, you know, if there's no injury, if there's no open lesion, abrasion, or laceration, then the question is, and the skin looks normal, then there would be no reason to do that. Okay. It's bad enough when the birds are pulling their feathers and you have the exposed skin. And if and sometimes there's no feathers at all, but if there's any feathers that are remaining, that if you have a gel or some type of any type of a product that mats those feathers together, it only exacerbates the problem. And so if there's you can, and I don't believe in an amount that is the kind of a useful amount of it, and a judicious amount of it, that that it would have any problems. And usually a judicious amount of anything on a bird's skin is glistening,
Mm.
glistening, where there's no evidence whatsoever of the product, the ointment, the gel, the whatever you put it on, is where there's no globs or no visible evidence of it other than it's glistening. If it's more than that, then it's going to get, feathers are all matted. I mean, it's not unusual, and it's fine, and we don't mind doing it, but we bathe birds when needed, when their feathers are all kind of glued together with some kind of a product. And this is problematic, because you know how fastidious birds are in grooming. And you can argue that, well, they may be fastidious in grooming, but he's pulling out all his feathers, so I don't know what that means. And but we don't want to make it worse. And so that's why I always say, if you're gonna want to spray the bird with something or put something on, just water, warm water, just with a mister or what have you. Yeah, and that's what I would say. But if there's no, like I said, there's no lesion, no abrasion, no laceration, then I don't think that the aloe is going to be beneficial, and it may exacerbate it. Not that it would be toxic, but it would just be, or cause a bad reaction. But I just don't. I think it would be both psychologically and just physically problematic and stressful for the bird.
Okay. Okay. Oh, a question about what is the temperature you recommend for indoor and outdoors? And they want to know, for example, if you to take a walk with the bird outside, or if you lose power, heat, etc. Are there extremes, weather extremes that?
Yeah, well, that's a good question. I think that anything outside over 90 degrees Fahrenheit and the bird is exposed to the direct sun, um, because we all know aviaries that are, where the birds are in the shade, or they have places to go, and there's wind and breeze, what have you. But in a direct sun in an enclosed area, anything over 90 degrees, I would say is you're starting to get, that's a critical temperature. I mean, you have to be very careful, and you want to watch out on that. And as I've said, birds are much more adaptable to cool or colder temperatures. And so, if you're looking at, let's just pull out 70 degrees Fahrenheit. Let's say that's what we keep our house. Let's just say that's what we keep our house at 70 degrees. And so in the summer, it's going to be a little warmer, and the winter, it's going to be a little cooler. If you have a temperature extreme within the house or outside, then what you're looking at is, if it's going to get warmer in the house, then you'd want to say it's in the summer, that you'd want to make sure that bird within that, wherever it is, that it's within the upper 80s, because it can be very, how would I put it? It could be kind of stuffy. There could be no air movement and things of that nature, and it could increase, and depending on the temperature, the humidity, they call that the heat index, right? You have the temperature plus the humidity. It makes it hotter than it normally is. So we go into weather here, and then you have the cold, and that is a little bit different. The birds can withstand probably going down into the 40s, and if it's normally, as the temperature drops during the fall. It's finally dropping here a little bit. It's November, but as it drops, the birds acclimatize. They acclimatize to that. I've always said, in Louisiana, you show me a bird in January, I can tell you if it's an outside bird or an outdoor bird. There's a lot more down feathers on that outdoor bird than there is in the indoor bird. But they acclimatize now. And so they'll even acclimatize indoors. And so when that happens, they can withstand, lower temperatures. And there's birds that have acclimatized, I've seen out playing in the snow and stuff like that. As long as they have wind protection and they're protected against the elements. So in under normal circumstances, I think you're looking between 40 degrees Fahrenheit and 90 degrees as the birds being able to adapt and adjust. Normally, anything lower or above that, you really need to be careful, and be watchful on that, because that is dangerous territory. I think the potential of danger increases with each rise in temperature over 90 and with each drop in temperature over under 40 degrees Fahrenheit. But that, there's other factors. Where is this at? What's their exposure to the elements and different things like that. And then that can all be variables that affect that a little bit or more than a little. How's
All
that?
right. That's good. That's good. We're getting into the weather changes, so
Yeah, that temperature index, the wind chill factor. There's the wind chill factor, and that's so you have the heat index and the wind chill factor, and
pay
yeah.
attention to your weather reports.
You have the atmospheric rivers and
Yes,
stuff like
that's
that.
right. So we have a question about a Hans macaw. So when the Hans macaw was 3, he cracked his lower beak. So after surgery, a small stem remains on the lower left part of his beak. It doesn't affect him eating, but he seems uncomfortable. And the vet said shaving it down is very difficult due to the area's sensitivity. So
Mhm.
can you explain why and offer any advice? Do you have any advice for the cracked lower beak?
Yeah, I don't disagree. I mean, if you're looking, I can use this. I kind of like it. I kind of like it. You see my little
Oh,
doctor, my
yeah,
Dr.
an
McCaw.
hyacinth there. Nice.
Yeah, he's ready. He's ready to give me a shot. But if you're looking at if it's the lower beak, I think, and if that may be over in this area where it is, I don't know exactly where, but if it's on the side of the little
Lower left, the lower left.
the lower left, yeah.
Yeah.
So that's his right. This is his left over here. So it'd be over here, and so with that's where the problem is. If you can see, and right there, that's difficult to get to. Okay. It's not say impossible, but if it's bothering the bird, then there may be something. You don't really want to try. You don't want to put the bird under anesthesia every time to do it. But depending on, and we have a number of birds. I mean, a number of birds that have beak injuries. Uh, Usually because of playmates. Okay, that's where most of the bird injuries come from. Other birds know, like, I'm going to get your beak, and so we have to trim. I just trimmed down. It was a little Quaker just the other day, what that had injury, but. Here, if it's bothering the bird, or if you think it's bothering the bird, then it may be difficult. Maybe sedation may be helpful to work to try to get that little piece done. But you have to be kind of adaptive, innovative, and try to do what you can to try to work with these beaks. And each one's a little bit different. Some are more difficult than others, but usually there's some type of method that can be used to try to resolve it.
Okay.
Yeah. So, yeah.
All right. Let's see if we have, oh my gosh, we're getting close here. All right, just
Yeah.
my
I mean,
pocket's
you
here.
have to, you have to, it's not necessarily, not necessarily anesthesia, full-blown anesthesia, but sedation too. The other thing is if somebody's not comfortable with it, and that's just like what I say. I tell owners, if they want a second opinion, by all means, I give recommendations. If I go to a physician I don't like, I'm going to get a second opinion. Everybody does the best they can, but possibly if somebody can't do you have an issue and it can't be resolved, I can't resolve it, then I'd say, well, go see somebody else. It's nothing bad. It's not to say that somebody's not doing the best they can, but somebody else, you can always ask, well, is somebody, do you know somebody that may be able to perform the procedure? I mean, You know, I had a case where somebody wanted a budgie to, the kidney removed on a budgie, and it was like, I'm not doing a kidney. Well, we'll talk to Dr. Bennett. Maybe Dr. Avery Bennett can do that when he was in San Francisco, and so that's I don't think it ever happened, but at the same time, it was like, no, not going to be able to do that. But you want it done, I'm going to try to find somebody that can help you. You see, and that's the way you would hope that your doctors would be, both physicians, veterinarians, dentists. So
Okay. All right. I'm going to kill this word, but I'm going to give it my best. This next question is, so my parrot got stuck. My parrot got stuck in a happy hut and suffered from severe, rhabdomyolysis.
rhabdomyolysis.
Thank you.
Yeah.
Thank you. Don't ask me to spell it either because almost passed away. So spent several days in intensive care. Now months later, still on milk thistle. Can you expect that forever? It's a 35-year-old Myers. So if you could just
Wow.
explain, yeah, what that is real quick.
Wow. Well, fantastic that has overcome that. I mean, we've had birds get their heads stuck in the cage bars, and we've had to do the different treatments. That's interesting. Most of the time when you're looking at that, you're looking at that's just kind of muscle inflammation, rhabdomyolysis, or and so you're looking at muscle damage is what it is. And then when muscle, it's kind of like severe cramps, on a greater magnitude, where you have actually enzyme and toxic and the muscle fibers themselves. Some of them die because they don't have a way to kind of expand if uh, they they don't have a way to expand within their little sheath, and so that when they do expand, it's only so much, so you have kind of muscle that damage. Okay, that's great. Muscle not great for damage, but a good way to describe it. And this muscle damage causes kind of a toxic condition within the bird. And it's also something that we see what they call capture myopathy. And I don't like to call it capture myopathy unless we're capturing the animal, but it's an exertional myopathy where the bird's trying to get out, and it just wears its muscles out. And so the primary focus, and it's interesting you said milk thistle, because milk thistle is, and the silymarin that is associated with milk thistle is a kind of a active ingredient, is kind of a liver protectant. Okay. It really doesn't treat anything. It kind of protects the liver tissue. And so I'm not really sure what it's on milk thistle as far as protecting the liver, what you're protecting it from, because most of the time when you have muscle injury, it's going to be kidney. You're worried about renal damage. And so that's our big focus when you have muscle injury. So if the renal, if the bird's renal values are normal, he's having no problem urinating, defecating, hydration status is normal, then I don't really know what why it would be on a liver protectant. But I mean, I'm not familiar with the case, but that's a good question to ask your veterinarian. It seems, I mean, wow, getting the bird, I can't imagine him being stuck in the hut, and I mean, he's done a great job. Or she's done fantastic to get it to survive and overcome, but possibly to answer your question, possibly you won't need to be on milk thistle its entire life. Yeah. And I mean, 35 years for a Myers. Woohoo. I mean,
Yes.
that's great. Keep up the good work. Yeah.
Yeah. Okay. Wow. Okay. So we are at our hour. Actually, thank you for got some
Already.
I know it blew right by. Yeah. Yeah. It just
Well, fantastic. Great questions today. I'm
I
telling
know.
you. I mean,
Yeah,
I'm thankful.
we had a
I'm
lot
thankful
today.
for all of the attendees. And yeah.
That's right. And you know, the good thing is we're going to be back with you in December the 14th for another Ask the Vet. So if we didn't get to a question today, maybe we can get to it next time.
Yes, very much so. And we need to find out about gooseberries and golden berries.
Well, apparently gooseberries make a delightful pie because I did see some comments about
You
that.
know,
So,
I've
yeah,
heard
so now I want to try gooseberry pie.
but I'm gonna dig a little deeper on the gooseberry. You know, that's an
I want to
interest.
see I want to
I'm-
see a slice of gooseberry pie when we see you in
yeah, yeah.
Oh,
Maybe our attendee could make one and show
recipe.
what a gooseberry
Oh, there you go. Yeah, someone can make
pie.
a gooseberry pie for us for next to show us virtually. That'd be great. That would
That's
actually.
right. That's right. That's great.
Speaking of good food, I gotta announce this my segment. Today's giveaway winner, and that is going out to gosh, Shelly Manis. I hope I pronounced that right. You're gonna get some pumpkin berries giveaway. Like this is the end of the pumpkin berry NutriBerries. So pumpkin spice NutriBerries going your way, as well as another Lafeber product of your bird's choosing.
I have a question though, Laura.
What?
What is the Christmas flavor NutriBerry?
Oh gosh.
Peppermint bar?
What would you want it to be? I mean,
I don't know. I mean,
peppermint okay for
I
is
know.
peppermint okay for birds?
No, I can't do it. No,
Candy cane?
I'm just joking there. But I was thinking, what kind of and that's for the attendees. What kind of
Yeah. Off the top of
Christmas?
my head, I would say peppermint or nutmeg. But I
Yeah,
don't
I
think
mean, I
it's
don't know if peppermint would be it, but
peppermint.
I mean, it's just like, well, we had the pumpkin. I kind of
Yeah.
like the whole holiday thing, but maybe can have some suggestions for
Eggnog. Yeah, there we go.
eggnog. Yeah,
That's
there you go. There you go.
eggnog's my
Eggnog.
favorite.
I like that.
I've
I
eaten
like
that.
that.
That'd be great. We'll have to tell the folks at Lefebvre what the next
Yes,
vote
yes,
on.
yes.
Okay, before I forget, also, so we next week is, that's the day after Thanksgiving, so everyone's gonna be like, probably sleeping in. So we'll be back on gosh, I think it's December, oh, I had it up, December 6th with Dr. Lamb. She's gonna be chickens and parrots. Can you have both? So she's gonna go over the yeah, if you have both, if you have chickens and parrots, what you need to do. They'll be back with you on the 13th. I'm sorry, I said the 14th there. The
The
13th.
13th. Oh, good.
And then our big annual, which is like you gotta make sure. I mean, of course, attend all of our webinars, but the 20th is our special holiday giveaway. So we were going to give away. We're going to be on with Lisa Bono, giving away fabulous products again this year. So it's you definitely got to be there to win it. So everything that Lisa's going to show, we're going to be giving away to our viewers. So there you go. On that note, now I gotta wish everyone an extra wonderful weekend because we're heading into a holiday, or like the first of a holiday season next week. So yeah,
Yep.
and I'm gonna circle back to what you said at the beginning of the webinar. Just be thankful, right? We got to be grateful. And
Thankful.
thankful.
That's right. That's
So
right. And enjoy, so that's what Thanksgiving's about, but
there you go.
thank you, Laura, and thank the attendees and Lafeber for another great Ask the Vet, and
All
see you
right.
in December.
Yes. All right, everyone. Have a great weekend. All the
All
best to you.
right.
2 o'clock. Everyone stay safe.
Bye.
Till next time. Bye.